quietly join.
Hello and welcome to our training. My name is Lindsay Dragon and I will be running a PowerPoint quickly while we're waiting on others to sign in. So just give us a moment here. And I want to share with you some of our events that we have coming up. And while we're waiting on everybody to sign in, you can see if you would be interested in any of these events coming up starting this Saturday. We're not doing any events in July because we had a very busy June. Thanks to everybody who was presenting for us. Monday and Tuesday, we have events. So this is from an OT's perspective there. And this is going to be a fun one, Autism in the Outdoors. Lots of fun information there from Liz Macy. Here's some basic information for the Autism Center at Misericordia. And this will loop through at least 2 more times before we go to our presentation. And if anybody's interested in the ALL program, usually for ages 18 and older, but you can start as early as 14 with these transition to work skills. So we'll let this run through 2 more times, ladies, and then we'll go ahead and begin our introductions. This event here is from a Misericordia graduate. So she's an occupational therapist and she has some fun stuff planned. That'll be a fun one. How many people hate the bugs out there right now?
They're terrible.
Yeah. So hopefully that involves a net or something. The Autism Educator Support Alliance is geared towards educators, whether you work with kids, if you're in a school or in a professional setting, a lot of those are going to be for you. So that Facebook page is ready to rock and roll. And those things will pick back up in August as well. July is going to be our break this summer. Okay. Just waiting to let people sign in. I'm very excited to see the child's yoga. We'll see that. Okay. One more slide and then we'll go ahead and get started. The ALL program is up and running as we speak. I don't think they ever really stopped because people were able to work during that time. So this is up and running as we speak. So, all right, I'm going to stop my presentation there. And I'm going to introduce myself again. My name is Lindsay Dragon. It shows me as Kristen Hoffman because that's our Zoom account. I am the administrative assistant at the Autism Center at Misericordia. We're one of the 5 autism collaborative hubs. So what I'm going to ask is if you have any questions, if you run your cursor along the bottom of the screen, you'll see the chat icon. And if you click on that during the presentation, you can ask a question at any time. And at the end of the presentation, we will answer those questions. I will be asking the ladies those questions for everybody. So I'd like to introduce the presenters from Beyond Behavior Consulting. We have the 3 managing partners and all BCBAs. So we have Joanna Cunningham, Danielle McGurk, and Jennifer Silva. So thank you guys. You've done several trainings for us personally, but also, over the years, you've done several that I've attended, and it's always been fantastic. Today's topic is executive functioning skills. Parents can practice at home. So go ahead and we're ready for you.
Okay, thank you. Thank you. So today we're going to be discussing executive functioning. This is something that I feel very strongly about. It's something that's relatively new to the field. It's been discussed previously and over the years, but we're developing and getting more research every day on it. And we're going to focus today on what executive functioning is and how it affects the brain. And the majority of the presentation is going to revolve around sort of the why, because I think that it's something that a lot of people don't understand. So one of the things that I really stuck out to me when I was going through educational courses and teaching was that when someone doesn't, that quote that when a child doesn't understand math, what do? We teach it. When they don't understand English, we teach it. And when they don't understand behavior or they misbehave, our reaction and the way that our system has been established in the past is to punish it. When we don't behave, we punish. And education and behavioral supports have now moved into positive behavior support so that when we don't understand how to behave, we teach how to behave. We build the skills that a child needs to learn to behave and to act appropriately in the environment. So rather than saying no, we are able to say, let's do this instead, right? Here's some skills that you need to build so that you can be successful behaving in the world. And so that's why executive functions are really important. So what are they? They are a collection of brain processes that guide thought and behavior located primarily in the prefrontal cortex, but involving other neural networks as well. So the executive functions are essentially the conductor or the CEO of the brain. They control the other functions. They manage your brain. So they are higher order cognitive skills that enable independent, purposeful, goal-directed behavior. They're a set of mental processes that help connect past experience with present action. And they're caused by abnormalities in brain structure or brain development. That could be delayed brain development. They're caused by trauma or damage to the brain, and sometimes caused by age. So there's a lot of research now coming about that has to do with age and how as we get older, those processes start to delay or diminish as well. So as we know, children with autism have difficulties or differences in the brain that provide them with different symptoms of their disorder. And these symptoms, which we'll learn about, really revolve around how their brain is able to function. So executive functioning refers to functions that activate, organize, integrate, and manage other functions. The three main components of that are working memory, inhibition, and flexibility, right? So any of you who have children with autism or children in general, I mean, I think we all have issues with executive functioning. It's something that is developmental that we need to learn. So even young children have poor, less engaged executive functioning skills. And as you get older, you develop higher order executive functioning skills. So it really is in reference to all individuals. But for those of you who have children with autism, you are aware that these are major deficits and major symptoms of the disorder. So things like planning, organizing, initiating a task, sequencing, being adaptable or flexible, regulating your emotions, coping, all of those skills take place in that prefrontal cortex and make it difficult for children to be able to gain those skills. And just as we teach a child who has a communication delay to speak, we also need to teach a child who has executive functioning delays to behave and to learn and to plan and to develop. So these are some core components of executive function: impulse control, attention difficulties, emotional control, flexibility in thinking, initiating tasks, memory, planning, and prioritizing. Kind of listed some of them. We use these skills every day to make plans, to keep track of time, um, to know what we're doing. We use calendars. We have to keep our contacts, our meetings, everything all in order. So this goes essentially from, you know, being a young child all the way up to adulthood, engaging in group dynamics, knowing not to interrupt, knowing not to lead the conversation or take over the conversation, knowing to raise your hand in class when the teacher is speaking rather than just call out ahead of her, and making mid-course corrections. So that's, you know, about having flexibility in your thinking. If you're doing something and you realize, oh, you have to realize I have to stop and change because the conversation went a different way, or I was running outside in the rain with muddy shoes, and when I go into the house I have to stop, I have to take those shoes off, and then I have to and then go inside. So these concepts span all age levels and all developmental levels.
You see a lot of those, a lot of times with children on the spectrum, you see like in that school setting, you know, sometimes challenging behaviors might be less and they're doing well in terms of appropriate behaviors, but then you start to see a lot of the deficits when it comes to just staying organized or being able to transition from one class to another, knowing what to bring. So a lot of times you do see that in the academic setting a lot, where some of these skill deficits really come into play, that we need to intervene on and start to kind of prioritize.
Yeah, and those tasks come into play really early. So as children get older, their independence in executive functioning skills typically increases. So their independence increases, and teachers stop telling them every single direction, and they start to say, okay, well, you're going to math, you know, and they don't say, you're going to math, you need to get your math book, you need your math binder, you need this. And they stop providing those prompts for children. So for children with autism or children who have difficulty with executive functioning, they sometimes take longer to develop those skills, and or always need prompts. And again, when we provide prompts or we provide visual cues or strategies, we always want to plan to remove those environmental strategies or interventions, but sometimes it takes longer than others with certain kids. So these are just a list of specific deficits, things that I think you will notice your children do every day. And we actually are going to go through you know, a day in the life of someone who has executive functioning difficulties. But there are things that happen all the time with all kids that we have to just pay attention to, the fact that this may be you know, difficulty in the brain, and how can we plan and program for their behavior around that. And I think sometimes understanding that we need to teach these skills is really, really important. So difficulty in long-term projects, difficulty with rigidity, with transitions, with impulsivity, lack of personal safety. One that I find interesting in working memory is difficulty telling stories. And sometimes that often flows into lying. You know, we'll see children who have difficulty understanding abstract versus literal concepts. Maybe they're thinking about something that they did before, even though you're asking a question about what they're doing now. And so that looks like lying behavior sometimes, and it might be an executive functioning issue. And organization is something that you know, we have to teach over and over and over again in order to make that a concrete concept for some of our kids. So this is just something that I found that was a really great example of executive functioning around the clock, right? There are all these different areas of executive functioning, and these are things that this boy, Josh, has trouble with throughout his day. So he knows he forgot something, forgets his cleats for today's game. He sprints back inside the house to get them and leaves his backpack in the kitchen. He walks right past the checklist his mom made to help him remember, but it's too late. The bus is here and about to pull away. He's going to miss it again. At 11 a.m., Josh's English teacher stands at the blackboard and asks, "Tell me how last night's reading relates to the words on the board." Every hand in the class goes up except for his. His heart sinks thinking about all the steps answering the question takes. So sometimes when our students or children are learning, they're doing multiple steps, we see an increase in difficulty completing those tasks and or anxiety are related to those tasks. If your child is in 5th grade or 4th grade, you'll kind of understand that they have a multi-step math problem and they can do every individual step, but they can't do the whole problem all together. At 1 p.m., we're looking at impulse control and self-monitoring. So now he kind of has a break. He's at lunch, he's with his friends, he's excited, and doesn't really recognize, he's talking a mile a minute, he's talking too loud and jumping in and out of his seat and doesn't recognize that he's getting in trouble and that his friends look annoyed. So it's, at this point in the day, it's becoming socially isolating because he's not recognizing personal space. He's interrupting people. He's overtaking the conversation. And so those are things that are difficult socially. So this is now after school at soccer, and he knows that in soccer you kick the ball as hard as you can, but where? He can't remember, so he just kicks and sent the ball right into his own team's net, and the teammates are mad at him, right? So I know soccer, when children are playing organized sports, any of you who have, if you have experienced watching someone just start those tasks, it's difficult to break them down and recognize all the rules. You have to sort of learn one rule at a time, where typical children may be able to learn 4 or 5 rules all together and kind of move forward faster. So that deals with flexibility and working memory. It is time for dinner, but first Josh has to set the table. Josh scratches his head and tries to remember exactly what goes at each place setting. He thinks he has got it right this time, but his little sister reminds him that he doesn't, and he loses control, right? So that's self-regulation. And sometimes it's difficult to get things wrong or not do them right, and then you have emotions about that. After hours of cajoling from his mom, Josh finally sits down to do his homework, but where to begin? He has several projects and papers that need attention, but doesn't know what to do first. He delays and procrastinates, and he's exhausted and remembers his history papers due tomorrow, but he just can't figure out a structure for the paper. And then he goes to sleep and he's anxious and he tries to remember things that he needed to do today that maybe he forgot, and then forgets his things in the morning. So this is a typical day. This kind of looks like our own typical days sometimes, where we're looking at organizing and planning and we're overbooked and overworked. But these are things that are important to be cognizant of when you're looking at children who have special needs, who may have further delays in these areas than we do.
And you could see that all of those steps, if things don't come easy to us, it's high effort, right? So even building upon those skills, it's still going to be a higher effort thing than somebody who has, age appropriate level executive functioning. So, you always need to look at that effort. Sometimes if something is too high effort to be able to do, or you don't have the skills to do it, it's not going to get done. So I just think hearing that story, thinking about how much effort it takes for them is draining. For sure.
I think it's super important when talking about executive functioning is we look at it, and Joanna touched on this, as a skill deficit, not a behavior. It's not a behavior, so we have to teach, we can't punish, like Joanna said in the beginning, and that's so important because they just can't do it. So we have to figure out ways to manipulate their environment to help them understand how to do it and treat it, not punish it.
And I think so many people don't recognize that these specific deficits that go into that. I see a lot of therapists and teachers and parents alike that kind of say, even something as simple as a working memory issue where you're learning to speak and you said mama yesterday, and therapists or teachers or parents say, well, you said mama yesterday, so I know you can say it today. And that might not be true, right? Because that short-term memory is not developed the way that it needs to be. So once you practice and practice and practice and it moves into your long-term memory, then they have the skill. But if you're just learning something new, and for children with autism, that, you know, you might learn, for a typical child, you might learn something quickly in a couple of days. You might remember it after the first time. But a child with autism or with these deficits may take longer to learn those skills. It's not that they're misbehaving, it's that they don't have the ability to respond the way that they need to.
I mean, long means years. I'm working with kids that are working on executive functioning, and it's years. You know, you start with higher level prompts like visuals, you know, cue after cue, and you know, it's after year one you might start to fade the visual, but they still need a verbal prompt. Then you start to fade the verbal prompt at year two, and then they just need a gestural prompt. Then year three, they just need a look. So it really is, it takes a long time to build these skills to mastery. But I see every day, you know, just putting little interventions in place to get better and better, and you see progress. But it takes long. It's not like a behavior 2 weeks and it's done. It's years of work.
Yeah, that's a good point. So there's a lot of information about diagnosis and assessment. This executive functioning difficulties run through many disorders: autism, ADD, ADHD, obsessive compulsive, oppositional, right, disruptive disorders, traumatic brain injury. So it runs through a lot of things that a lot of our kids are experiencing. And so there are different methods of diagnosis and assessment that you can look at. And you know, sometimes the question comes up, is it the brain or behavior? And I think that's the focus of today's presentation, is that it's both, that we need to understand why those things are happening, and we need to recognize that it's not defiance, right? It is a skill deficit. And if you know, as a parent, you know your child, you know if they know something and they're being defiant, or if they really just seem like they can't get it. I think as a parent, you know, we're busy, we're doing the laundry and we're doing dishes and we're running around and we're not paying attention, and we just, you know, if we said it 5 times, you should know how to follow what, you know, my direction or what I'm asking you. And we're not sometimes thinking about the fact that they're not trying to be defiant, that it's going to take years of development to get them to have the skills that they need in order to do these things that we want them to do, and these things that enhance, you know, their quality of life. So understanding executive functions and how the brain works will help us understand why the behavior is occurring, so that we can provide environmental and behavioral supports to help. We need to understand these as parents, because children need to have control of their behavioral, cognitive, and emotional skills, right? They need to learn to inhibit or wait and not be so impulsive. They need to learn to plan, and they need to learn to persist or persevere. So one of the methods that we do in order to intervene on this is a stop, think, plan, do type philosophy. Where you don't want to go rush right into something if you're having an emotional response, or if you're unsure, or you're having anxiety about it, or whatever the case may be. You don't want to just rush. You need to stop. You need to think about what you're doing. You need to organize an approach, create a plan, and then you need to follow through and commit to your goal and try to continue through that. And you need to learn how to monitor yourself. So in Danielle's presentation prior, you know, she did a lot of information, she provided a lot of information on activity schedules and checklists. And, you know, those activity schedules with leisure skills can lead to a child recognizing whether or not they're following the plan. And those are some really good prerequisite skills to engaging in some of these higher order behaviors. And I really liked this. It's not about knowing what to do, it's about doing what you know. So parents can help shape the actions and behaviors of their children, because we're going to be teaching them how to do. And what if you can't do? So if you can't do, teach, right? We need to learn how to provide prerequisite skills that might not be there in order for them to engage in these other skills. So kids need certain prerequisite skills. They need minimal weighting skills. They kind of need to know how to match and sort. They need to know how to sequence. They need to understand time lapse a little bit. But these are other things that they can learn in order to help develop executive functioning skills. So all of these skills help develop executive functioning, but they're also prerequisite skills in order to do those higher order skills. They need to learn how to request. I mean, something that happens a lot with my clients who have difficulty with inhibition or self-regulation is that when they are in a state of stress, they can, they have language, they know how to use it, they use it all day long, but when they enter into a state of stress, they're unable to cope and regulate, and then that leaves them missing some of these prerequisite skills. All of a sudden they can't wait for 5 seconds. They're not fluent in requesting what they need, which is a huge thing. So a lot of times we will just prompt, I need a break, and they might be able to say that to you any other time of the day, but when they're in that state of stress and they have difficulty regulating, they aren't able to perform those basic kind of prerequisite skills. And so sometimes it's a matter of recognizing that as well, that when you're in a high state of stress and you're unable to regulate, you can't perform the same basic functions that you always do. So
this is a good slide for parents to look at too, and kind of like how you broke it up into different areas, looking like right now, like, hey, here's a good list of, what areas are they really strong in and what areas are they not so strong in, to kind of guide you in, whoa, that's an area how can we program for that specific area?
Yeah, and that's a good point. Like, as you're looking at these things, it would be great if you have specific questions, right? Because we're going to talk about some general strategies, but there's been a lot of presentations and information thrown out that, about specific strategies for behavior and compliance and emotional regulation and coping, so we're just throwing general strategies out today. And again, the main focus is why is it happening and what's wrong. So it's important to work collaboratively with your child, right? Getting buy-in, motivation and reinforcement, number one behavioral principles that are going to help you in anything that you do. Using something your child values, providing prerequisite skills, which might really revolve around communication, the ability to talk about your feelings, the ability to listen, the ability to respond. And have descriptive praise, right? Don't just tell them good job, tell them, wow, I really like how you made your own calendar and kept that appointment without me having to tell you. Or I really like how you remembered your math book today. I really like that you asked me for help when you weren't sure how to calm down. I really like that you used that coping technique. And breaking down tasks into manageable parts is super important too, I think. So we talk a lot about, especially in ABA, about all of these types of interventions, services, and supports, right? Task analysis, Danielle talked about that in her last training, visual supports, prompts. But something really big that I think sometimes we forget to do, especially at home, is maybe setting alarms. And helping with time organizers, helping with calendars. I know when my kids were little, I printed out a big, like a calendar like they have in circle time at school, and we put pictures up every day of what we were going to be doing so that they knew what was coming and where they were going to be going on the weekend and where they were going to be going, that morning. We set alarms in the house for when it's time to kind of stop playing and brush your teeth and get ready for bed. And those things can be really useful. I know there's different apps and stuff now that actually have watches that you can wear, and you can set you can set up an entire day on it, and an alarm will go off like, hey, it's time to brush your teeth. Hey, it's time to get your backpack organized. So technology really is useful in that sense. And again, all of those things need to be faded out so that they can do them without them, but they're useful tools when we're first starting to teach these skills. Behavior contracts are a big thing with older kids. Hey, let's think about what you need to do. Let's set some goals for your behavior, for your impulsivity, for getting your homework done, doing a long-term project. Let's set some goals for it, and let's talk about what we're going to do for reinforcement at the end. What will you get for doing that? And sometimes you do have to provide additional reinforcement up front so that children have motivation and reinforcement for completing tasks. And then again, those things fade out and start to become more intrinsic over time. Practicing and role playing is really big too. Providing children with multiple examples of things that they can do or things that they can say or ways that they can problem solve really helps as well. And breaking down and summarizing tasks, a lot of that multimodal instruction, movement breaks, a lot of that is like classroom-based intervention, but even just providing simple directions, for children, for people with young children, we talk all the time, you can provide a lot of language and you can talk to them while you're playing and model long sentences of language, right? But when you need them to throw out the trash, you want to minimize all of that language and just kind of say, throw away, so that they are able to recognize, recall, and complete that step. And again, if you're giving 3 steps, you have to practice that skill, and you have to make sure that they know the language involved in all 3 of the steps. And you have to make sure that there's not too many distractions around, because if I do 1 step and I get distracted when I change rooms, I'm not going to follow all the other steps. A lot of kids have difficulty bringing a note to the office. And parents have concerns that, hey, my kid's going to bring a note to the office and they're never going to come back because somebody's going to be down the hallway doing something and they're just going to go follow them. So those are all really important skills to learn. And all these skills do sometimes revolve around.
I'm sorry if you said that, but what's something is really effective that I've seen is repeating back the direction. So, okay, you have to go take out the garbage and then pick up your toys. So what are you going to do? And then have the child repeat back, take out the garbage, then pick out your toys. And you can do it 1 or 2 times to make sure that it's in there. It's so simple, but it's actually I found it to be very effective.
Yeah, that working memory. So we are going to go just quickly through some of the major areas of executive functioning and some things that you can do to build those skills, some practice assignments, and then some things that you do to compensate for those skills, or things that you do kind of in the environment or day-to-day, some practical application. So for like developing inhibition, which is impulsivity, there's, you can do simple activities like draw a tree but don't use green, sing Old MacDonald without saying farm, play Simon Says, teaching wait and stop, teaching a child to give up reinforcement, setting time limits on electronics. Those are things that where you're working on wait, you're working on not being so impulsive, not needing something right that second. And having them save money to buy things, right? Older students or older children, yeah, that's awesome. I know you want that big toy, but we're gonna do some chores and you can save money and then you can get that when you're done. So they know that reinforcement is coming at the end, but they, don't need to get it right now. That stop, think, plan, do strategy and coping strategies, right? So the inability to regulate their emotions and the inhibition that might play, you can teach coping strategies and then kind of practice real life application. So not raising your hand for X amount of minutes when the teacher talks. That's something we have to do in school a lot. Not calling out, not raising your hand, or raising your hand and being okay with the fact that she didn't call on you. those types of things. So practice, reinforcement, and motivation are skills that you need through all of these strategies. But these are things that help with sustained attention, reading a book, quiet time, repetitive tasks. And then some things that we can do in the meantime are visual and physical cues, priming. So that means teaching them prior to doing the tasks, prior review of a task analysis, multimodal learning or active learning. So utilizing different techniques to learn a task or a skill. So we don't only have to be engaged verbally or vocally listening to the teacher talk and give a lecture, but maybe there's visual strategies or hands-on materials that will help us sustain our attention. Using motivation, eating meals at the table. I'm this day and age, we're like a grab and go type society. But if you take that time, we're going to sit down at the table. We're going to talk to each other. We're going to take a few minutes. We don't have electronics in our hand. Those are things that'll help sustain attention. Cognitive flexibility, practicing transition, practicing interruption. If you have a kiddo who really loves the TV or really loves the iPad and you turn it off, what is their reaction, right? Are they flexible in that? Are they able to move past it? Or do they have a really averse reaction to that? And if they do have an averse reaction to that, you need to practice transitioning. You need to practice interrupting something that is super important. Practice shifting their thoughts. And you can do that with role play or repertoire building. And something that's really important with flexibility is exposing kids to many examples, to many environments, to multiple opportunities for practice, and programming for generalization. So we know that a lot of our kiddos get really rigid, and it's super important to program for generalization so that they don't think that it's the same everywhere they go, or with specific stimuli presented. We can provide warnings, we can use cues and phrases and prompts and visuals, and all of those things for cognitive flexibility. And then planning and organizing. So we can work on matching and sequencing, understanding time lapse. There's really great activities on Teachers Pay Teachers that are executive functioning games, and they build working memory, and they look at planning and organization. And something that was really simple with understanding time lapse, we purchased a game for the center, and we were working on this in social skills. And understanding time lapse, they said, how many jumping jacks do you think you can do in 10 seconds? So it's giving young children a way to kind of understand the lapse of time. And I thought that was pretty neat. So you can teach that at any age, and it's a really important prerequisite skill. Using task analysis practice, playing board games, building Legos, right? So if your Lego has a plan and you have to follow it, that's a good skill building game. Using activity schedules or story mapping. And some things that we do in the moment are color coding, using timers and alarms, using calendars and lists, decision trees. I know that some kids really have difficulty with making choices, so taking those concepts and going, okay, well, what would happen if you picked choice A, and what would happen if you picked choice B, and what choice are we going to go through? I think sometimes decision trees will help them organize and file that in their brain in a more visual way, so that they're able to easier make a choice and then make those choices quicker over time. Developing working memory is fun, and it's something that we always have to work on. It's something that they're doing a lot of research now on with Alzheimer's and dementia, and kind of are we able to develop our working memory and practice with it and keep it going? So things like running errands or delivering a message, right? You have to remember where to go, what to do in multiple steps. Playing card games, talking Pig Latin, spelling bees, and memory games. And things that help us remember are mnemonic devices or humor, actively engaging in tasks so that we remember them and do them. But again, with memory too, it's practice, practice, practice. You have to do it multiple times. You have to recognize that a child's not going to know it, from the first minute, and then it's going to take time. And then self-monitoring and regulation. So self-regulation is obviously a super important skill, right? How do you deal with the emotions that you're feeling, and how do you regulate yourself when you're feeling them? So we do a lot of role playing or goal setting, a lot of coping strategies for self-regulation, and we talked about some of those in the inhibition section. But we also want children to be aware of their emotions and aware of their reactions to those emotions and aware of how they're dealing with them. So video modeling is a really great tool for this. Checklists are a really great tool. So what maybe is your goal, and did you meet it? If you really get angry when someone does something and you usually yell and scream, what are you going to do next time? And monitoring that you're able to perform that task, and that you met your goal or you weren't, and what can we do, instead. And modeling, I think, is huge. And I think that the emphasis on language while you're modeling, I am really frustrated right now, and I need to calm down. And this is what I'm going to do to calm down. And that will help me make this choice instead of that choice, and kind of talking kids, especially older kids, through all of that. And even if that's happening in your home, talking, I am really mad that, I have to do the dishes and nobody else helps me with them. And I think that right now I want to yell and scream and engage in this certain behavior, but I'm going to go take a walk and I'm going to come back, and then we're going to develop a chore list. So everyone's helping me do the dishes. Those
I think
things.
what's so important with that self-regulation, self-monitoring, what kids on the spectrum it doesn't come naturally is, we could skill build, we could teach as many coping strategies as we need, and they can use it appropriately a lot of the times. But I think the antecedent of, like when we wake up and have a bad day, and we just can't say we did 50 things yesterday, but today we wake up and we're just not feeling right, maybe we can do 10 things. Kids on the spectrum, they don't know, they can't, or kids with, executive functioning deficits, they can't tell us, I'm just not in the mood today. Whereas a lot of times parents or behavior techs or teachers or even behavior analysts are like, well, he did 50 things yesterday, so why is he only doing 10? And it turns